Experts are saying addiction in our society has reached crisis levels. And joining us now to talk more about the issue and the solutions is the CEO and president of Jackson House, Dr. Bruce Figuered. Bruce, good to see you.
Good to see you again.
Tell us about Jackson House. What do you do at Jackson House?
Sure, yeah. Jackson House is an organization that provides mental health as well as addiction treatment for individuals who are adults. We provide both residential treatment as well as outpatient services at one of our companies called West Coast, and then we also provide detox services at our addiction treatment center called Jackson House Recovery Center.
And where is it located?
Jackson House Recovery Center is located in Golden Hills,
okay,
overlooking downtown, a beautiful facility. We have a residential mental health program in La Mesa, so specifically for mental health treatment, and then we have our West Coast facility. We also have a facility that we recently opened in Oregon. We have one in Ventura. We have one in Central California, as well as in Temecula.
Wow.
Yeah.
I think when it comes to addiction and the news and this news cycle right now, what's on a lot of people's mind is the situation with Matthew Perry.
Yeah.
A lot of people, we hear about fentanyl, but ketamine?
Yeah.
You know, what do you know about as you read about this and learn about the situation?
So ketamine was a drug that was originally developed in the 1960s, and it was used for the induction of anesthesia or maintenance of it. It was also used to treat pain as an alternative treatment for pain back then. Then in the 1980s, it became a drug where people started to abuse a little bit more. And then in the 1990s, it was part of the rave scene, and people were taking it when they went to these rave parties. And it's a hallucinogen. It also has dissociative properties. So what that means is that you become sort of disconnected from who you are and your feelings, and it can be very, very dangerous.
And it's very addictive?
It can be addictive, yes. And then like many drugs that are addictive, like opiates, like fentanyl, like alcohol, what happens is that you build tolerance to the drug. And then as you build tolerance to the drug, the amount that somebody needs in order to experience those effects gets more and more. They have to take more and more in order to experience those same effects. And then as that happens, with a drug like ketamine, what it does is it suppresses your neurological system and like your heart rate, your breathing, all those kinds of things, similar to what an opiate does. And as that happens, what can happen is the person can end up dying. So I don't know the specific details of what happened with Matthew Perry, but knowing that he was abusing ketamine and knowing that this is what the drug does, it's easy to make that inference.
We are inundated with a homeless population. What are the correlations between mental health, drug addiction, and homelessness?
Yeah, I mean, very high correlation. So some research that I've read points to up to 70% of all people indicating that a substance use problem led to them becoming homeless. There's other estimates that say that between 40 and 60% have a substance use problem that are homeless, and 70% or more have a drug addiction problem. So the correlation between all those things is very high. And then that sort of begs the question of what can we do about it? How do we fix this problem?
Okay, what are some of the stigmas that keep people from getting treatment, in your opinion?
Yeah, I mean, when people have an addiction problem or they have a mental health problem, historically there's been a lot of stigma associated with it. And so people don't want to come forward and say that I have this problem. A lot of people see that as historically as like a sign of weakness, or it's a weakness of character. But really, the treatment for a mental health or an addiction problem is no different than getting treatment for a medical problem. And I think as a society, we've come a long way, maybe from when early on in my career, in terms of the perception of mental illness and addiction, and then the willingness of people to go and get help. Because that's really when a mental health or an addiction problem reaches a point where somebody needs help, they really have to have some ownership of the fact that they can't do it on their own.
If there's somebody watching who has a friend or family member who clearly needs help, what would you recommend? How can they reach out to you at Jackson House?
Yeah, I mean, just give us a call. We are in network with all of the commercial insurance companies. We take people at an in-network level. When you call, we will give you education about what services are available, and then also provide guidance. If it's a family member of somebody that is struggling, we can provide guidance on the best way to get help.
Okay, the website?
JacksonHouseCares.com. We also have a podcast. It's the Jackson House Podcast, and there's a lot of great information on our podcast as well.
Okay, Bruce Figuered. Thanks for coming in, Bruce.
Thank you for having me.
Appreciate it.
Good to see you.